Hi, I'm Jonathan Staiano, consultant plastic surgeon and the director of the Staiano Clinic here in Edgbaston in Birmingham, and I'm going to talk you through a case that we've recently done of an excision of a cyst. This is a cyst on the just on the angle of the jaw of this lady, and she came here to the clinic to have it removed. We offer a see and treat clinic, so we can remove these sorts of lesions on the same day as the consultation. And it involves local anaesthetic, which means an injection around the cyst, which stings a little bit to start off with, but then you don't feel anything. You still feel touch and movement, but you don't feel anything painful. And you can see here I've made an incision around the cyst, and often cysts will have a little dot in the skin, which is known as a punctum, and we excise this when we remove the cyst. If there isn't a punctum, then we just make a little elliptical incision over the cyst in order to take away a little bit of skin so that the bump that the cyst has made comes down flat once it's closed up. This ellipse of skin gives us something that we can grab onto while we're manipulating the cyst, and the idea is that the excision is done with a scalpel, and we try and keep quite close to the cyst wall. You can see that the idea when you're removing these lesions is that the cyst is removed intact. Because if any of the cyst wall remains, then the cyst can come back again. And that's one of the reasons why excision of a cyst is really the best way to treat them. Sometimes when cysts get infected, they can burst, they can discharge, and you think that they've gone away and they're cured. But if it's just the contents of the cyst that has discharged and the wall remains, then it can refill and it can come back again. So it's important to remove all of the cyst wall to ensure that it's not going to come back again. Once the cyst has been removed, we use what's called a bipolar diathermy, which are these blue forceps which can stop any little blood vessels that might be bleeding, and then the skin is sutured with these non-dissolvable sutures. We tend to use non-dissolvable sutures in the face and dissolvable sutures in the body, and a few very fine sutures in the skin which come out 5 to 7 days later, and it leaves you with a small red scar, which is a little bit red to start off with, certainly in the early stages, and then over time the scar tends to fade and become less noticeable. So I hope that's been useful. Cyst removal, which we've done here in the Staiano Clinic recently. If you have any questions or would like to arrange for a free consultation, then you can please get in touch with us. And as I say, by prior arrangement, we can actually remove your cyst on the same day as the consultation if this is something you'd like to consider. It'd be great to see you. See you soon. Bye.